When you go to your medical appointment, what could be better than just seeing one physician? How about seeing two doctors in one visit? Hello, and welcome to the Inside Scope, a podcast from Lakeland Regional Health, where we share insights from experts providing award-winning care right here in our community. I'm Dr. Daniel Haight, Vice President of Community Health. And with us today is Dr. Melissa Rusli, Associate Program Director of our Internal Medicine Residency and Supervising Physician at the Morrell Medical Clinic right here at Lakeland Regional Health. The Morrell Clinic is special for many reasons. And Dr. Rusli, welcome. And I'm really interested about the Morrell Clinic. It's right there, centrally located. Tell us about its location and a little bit about the clinic.
Absolutely. Well, thank you for having me here.
You're welcome.
So we are centrally located right across the street from the main hospital and emergency room. And we provide patient-centered care, primary care services to everyone in our community.
Well, I can see that being centrally located, the Morrell Clinic is got a great location. What about how do patients come in to see? What kinds of patients can I just walk in, or how do I get to be seen at the Morrell Clinic?
Yeah, absolutely. So you can call, email, message us. But yes, you can certainly walk in. We do have same day appointments available for new patients and for our established patients.
Oh, so same day, next day appointments, walking in, that's convenient. What about if I'm in the hospital and I don't have a primary care doctor? Because I know sometimes a hospitalization is unplanned, and if I'm fixed up at the hospital, I probably need to see a doctor outside the hospital. Mm-hmm. Do you see patients that have just, been recently discharged?
Yeah, absolutely. And so oftentimes when our patients come visit the emergency room or are hospitalized without PCPs, they'll leave with our clinic's information. And so we do have specific and dedicated hospital follow-up appointments specifically designed to get
so you carve out space so that if a patient's leaving the hospital, and also I think sometimes a patient might be getting care regularly at an emergency department, and that's great for emergencies, but really it's like the Morrell Clinic right across the street from the emergency room mm-hmm. is a nice clinic. If you're leaving the emergency room and you just need ongoing care?
Mm-hmm. Absolutely. And of course, our goal is always to try to prevent those emergency room visits. Nobody really likes going to the emergency room, so our goal is always to try to be able to provide services to our patients.
Catch things early. What's it like inside the Morrell Clinic?
It's very nice. So we recently went through an expansion, a new renovation. It just opened up last summer. But when you walk through our front doors, you'll be greeted by our warm receptionists. You'll get taken back by our medical assistants, get your vitals checked, initial questions answered, and then you'll see some of our lovely physicians that are really the heart of our practice.
So what type of physicians are helping patients in the Morrell Clinic?
Yeah, so our practice is the main primary care clinic for our internal medicine residency program.
Mm-hmm.
And so at every visit at Morrell, you will be mainly talking to and seeing one of our resident physicians, and they're always backed up by one of our supervising physicians.
And you're one of the supervising physicians, and you have a team of like 6 other supervising physicians, and those are the doctors you'll have. And that's what you meant by 2 doctors in one visit.
Exactly.
What I mentioned earlier is that they'll be seeing you, but then they'll also be seeing in a sort of an academic setting another doctor.
Yeah.
What's the good points about that?
Yeah. So, I mean, as a physician, we've all kind of committed ourselves to a career of lifelong learning. And mm-hmm. certainly as an individual, I would hope that you would want to have a doctor who's committed to always keeping up to date and learning about new medications, new treatments, any changes in medicine. And so that's really what our goal is as an academic institution now, is to make sure that we are thinking about what's new, what's new to learn, and what's constantly changing and staying up to speed on cutting edge medicine.
That's when I talk to family members who have come back from the doctor, it's, it should be a learning experience. Absolutely. And it sounds like you've created sort of a learning environment at the Morrell Clinic. It's a learning environment, not just for all of us. I learn every day, but it's also the patient and the family. It's that opportunity to ask questions. Do you find that the time and the interaction is a little longer than the standard medical visit?
Mm-hmm, absolutely. So all of our appointments are about twice as long, or twice longer than the typical primary care appointment. And so that gives you as a patient a lot more time to be able to talk to your doctor, ask questions, really get to understand your health a lot better as well.
And the Morrell Clinic, I know it's located there on Parkview and a road called Morrell Drive, but why is it named Morrell?
Yeah, so it's a nod to Mrs. F.A. Morrell, who was a generous lady here in Lakeland and had actually donated her land to make space for the original Morrell Memorial Hospital, which then eventually became what we know as Lakeland Regional Health.
And the care keeps going and going.
Yes.
I noticed also you were talking about what's good for a patient to remember when they're meeting their doctor and talking about what's happening. You broke it down into a really simple way of the 4 M's, the letter M. And I like those kinds of ways of remembering things. And I think those listening to this podcast, this is great if you're going to be the patient or you're an advocate for the patient, you're a family member, you're with somebody, as let's talk about the 4 M's. And I think that's one of the focus points. What are those 4 M's?
Yeah, so the 4 M's stand for, well, one, we want to focus on what matters the most to patients. And oftentimes that's mobility, mentation, as well as medications.
And I like that because they all interact. When you think about, well, what matters most to me sometimes is the medications, not just, a cost or what are they doing and how are they helping or side effects. So medications, but I've learned medications can help with my mobility. Or if a medication might be helping with your blood pressure but could make you a little dizzy, that might get in the way of mobility.
Right.
So I like that. Medications, mobility, and also I think what's most important for a lot of our patients is mentation. I want to remain sharp. And some medications can make you sleepy or interfere with medication. And there's some newer medicines out there that are helping with mentation.
Right.
All right. So medications, mobility, mentation, and what matters most.
Absolutely.
So tell me a little bit about that. So you're sitting down with a patient. I love that ability to say to a patient and the family, okay, now we've gone over a lot of things. What matters most to you? What are some of the things that patients sometimes will say?
Well, honestly, all of our patients are unique, so they definitely surprise us.
And that's why we ask the question.
That's why we ask the question. But that is also one of the wonderful things about how our clinic is structured with the longer appointment times, because it does give us a lot more time and opportunities to get to know our patient as an individual.
Yeah, and what's happening in their life, because oftentimes you think of a doctor's visit as this very short period of time where it's like, show me where it hurts, or what's your question, and you're dealing with that. And here's a test and then a prescription. But I think that longer appointment that focuses on these 4 M's, there's questions, and then it's what else is going on in your life? I used to even write down the name of the book the patient was reading. So when I saw them a few weeks later, I could ask them about that book. And they were like, how did you remember that? Well, I didn't tell them I wrote it down, but it's just knowing what's going on in your life. Did you just have to move? Did you have to change jobs? Is something going on in the family? And it might mean that what's most important to them might be how do I deal with a family issue? There could be mental health issues. I really think that's pretty good to have that all put together. I see the Morrell Clinic there at this central location by the hospital. Tell me about some of your other partners, like outside the 4 walls. What else are you engaging with, with your patients and you and your staff interact with?
Yeah, so within our practice, and so our, like many other primary care practices, we have a supportive team that helps us take care of our patients. So unique to our location, we have patient navigators.
Wonderful team members. I mean, from the receptionist, and then you have the assistants, but these navigators.
Yeah.
I'm hearing that term a lot, because medical care can be complicated. How are they helping the patient navigate?
So they help our patients with financial resources, community resources, even medical equipment too.
After you leave the clinic, here's what might help at your home. Here's what might help in your neighborhood. I remember patients, I used to never say fall prevention. I always said, because who wants to prevent falls? Yes, but you don't like that term. I liked, let's get you stronger, better balanced, more flexible. And there's sometimes at the YMCA and other places, there's places that help with that.
Absolutely.
And so so the navigator and your team helps people after they leave the clinic?
Yes, and they're housed in our clinic too. So oftentimes our patients will have visits with us, and then immediately afterwards, our patient navigators will come in to the exam room and continue the conversation with any additional questions or resources they may need.
Well, that's often what happens is a patient and family, it's understandable to forget and then remember a question.
Correct.
And when you're dealing with a great team at the Morrell Clinic, it's anyone along that line, you feel comfortable just asking them, I have one more question.
Mm-hmm.
What about after you leave? I think there is that connection that's getting pretty common nowadays. You can message the clinic or you can message your doctor.
Yep. So we use the Epic electronic medical record system, which is pretty commonly used across multiple institutions.
Across the United States.
Exactly, across the entire United States. So it helps make it easy for us to communicate to your other doctors who might even be outside of the Lakeland Regional system, or to help retrieve your records, especially if you're new to the area.
So as a patient, I can securely communicate privately with my doctor and my care team. Then the care team, that with the patient's permissions, you can also get medical records from Ocala or Miami or wherever they might have been, because that is huge, because it used to take time and you want to make decisions now.
Of course.
Now, inside the clinic, what kind of tools do you have inside the clinic that you see that benefit the patient?
So we do a lot of extra procedures and extra features at our clinic. So we also have,
instead of sending them somewhere else.
Exactly. So our goal is always to try to do as much as we can under our roof to make it kind of a one-stop shop.
I know joint pain is a common, thing. What can you do is if somebody's got some joint pain, before surgery is even needed? What are some things you might have?
So we have the ability to perform joint injections. So that helps to relieve joint pains.
The inflammation
For a long period of time. We also have a point of care ultrasound in our facility, so we can help make some quick diagnoses instead of waiting to schedule an additional imaging.
That to me has been huge, because you can get some questions answered if you could only see inside the body. And using ultrasound as opposed to an X-ray, ultrasound, what are some of the things you can see inside the person?
Yeah, so we can get a general sense of how your heart is functioning. If there's issues with your lungs, we can see some gallstones.
Gallstones, because that's a common, sometimes it can hit like lightning, and that might be an urgent care or emergency room visit. But other times it's this chronic discomfort.
Yep.
And, you always look for red flags, not having any fevers, not having any serious nausea, vomiting. But, chronic pain, you could take an ultrasound and look and then add it all together. But I'm glad you said everybody's an individual. There could be a lot of other things going on.
Absolutely.
When you get to know the patient.
Of course.
Well, that's pretty neat. What else is about the, the communication? I knew there's an effort that the clinic doctor stays in the clinic. And then if God forbid, you have to go into the hospital, there's usually a hospitalist and a doctor in the hospital all times.
Right.
How's the communication going in between the two, and what are some things we're striving for?
Yeah, so the communication's great. So unique to our physicians, our resident physicians rotate in the clinic, but they also rotate in the hospital as well. And
you're just across the street.
And we're just across the street.
Well, first you have a beautiful clinic. I think it used to be the original Hollis Cancer Center before that was even built.
Right.
And so it's a beautiful building, and then you've expanded upon it.
Yeah.
And now you're able to, communicate with the doctors inside the hospital, and then sometimes your doctors just walk across the street.
Yeah, exactly. And so we all operate as a team. So it is nice and reassuring to know that if, God forbid, you had to be admitted to the hospital, you'll be cared for by a doctor who also sees patients in the clinic and works well with your primary care doctor. And so there is an easy communication, an easy transfer.
Oh, that's perfect. And then plus, across the street is one of the best cafes, the Parkview Cafe at the hospital. There's great food there, and I'm sure sometimes patients and your team heads across the street to get a bite to eat.
For sure.
What about parking? That's always at the Morrell Clinic. Tell me about parking.
Yeah, so parking's pretty accessible, and so we're right next to some of the hospital's larger parking spaces and parking lots. It is pretty simple.
It's gone smoothly.
Yes, it has gone smoothly. Yeah.
Excellent. Now, if you want to become a patient, how do you become a patient of the Morrell Clinic?
Well, you can certainly give us a call. So our phone number is 863-687-1300. You can also request an appointment online on our website.
And again, I think that emphasis of, when you hear this podcast and you think about you're looking for a primary care provider, and there are so many people that don't have a primary care provider, this is one of those opportunities that you could make a same-day appointment. You could walk in. With it, you also have the Lakeland Regional Health urgent care centers. So if things happen a little more suddenly but are not a true emergency but sort of urgent, then you got these urgent care centers strategically located throughout the community. That's good.
Yeah. But certainly you can just come and call us because, again, we usually have same-day appointments that we specifically reserve for our patients to make sure that we can provide prompt care for them.
Perfect. And then also you have the, again, going back to, you're getting to see two doctors in the same visit.
Yeah.
And so you have a doctor such as yourself, expert in the area. You're all about preventative medicine, taking care of problems as they come up. And then you're with another doctor who is right there at their career. This doctor is expanding their knowledge.
Yes.
And there is the patient getting to ask questions and learn about, well, what's going on with my health or my family members?
Yeah, absolutely. And our doctors are brilliant. Like, they've graduated top of their class. We're so lucky to have them here with us. And they care so deeply for their patients. I mean, I have tons of stories and examples of some of our physicians who, when they get contacted or notified that their patient is admitted in the hospital, they'll walk across the street, pop in and say hi, talk to the hospitalist team to understand the plan, and then, of course, make sure that they get the care that they need when they're discharged from the hospital.
Well, the more communication, the better. And it's the patient, the family that pick up on, is every message consistent? And if there's a little difference, it's communication. Says, I want to understand, what are my options? What are the pros and the cons, with that? And I think that's been a big plus too. But with so much going on, you all are seeing so many different patients and so many needs. Does anyone stick out as far as an inspirational story and why we do what we do and we love what we do?
Yeah, absolutely. So off the top of my head, I can recall a patient who had struggled with his health for quite some time, and nobody could really figure out what was going on. He was admitted to the hospital, was cared for by one of our doctors who said, "Hey, why don't you come see me across the street instead?" And their relationship is just the best.
Because he was at the Morrell Clinic just across the street,
exactly.
And seeing them in the hospital and saying, "I know you're struggling with a lot of things."
Exactly. And already knew his story. But our doctors, they were just so committed and determined to help him, to continue to test, to find new treatments, therapies, anything to really improve his quality of life. And after, several repeat visits, they were finally able to get there. And so that just shares, one small example of the commitment that we have to our patients. And
I remember a parent who communicated with us, almost in tears, that say this was the first time that their son was getting this kind of wraparound care. I mean, including the navigator, the clinic that was welcoming them, hadn't really gotten health care for their condition, and part of it was diabetes.
Right.
But it was also the things that you look out for with diabetes. And the parent was just so relieved that she saw the improvements.
Yes.
And yes, there's numbers, there's test results, but she could see that her son was gaining back his life, was becoming more with that quality of life. And I see it almost went back to those 4 M's, mentation and mobility improved. And was a young person who was chronically ill, the parent was so inspired by what we had to offer. And I think that's what the Morrell Clinic was sort of always meant to be, was that kind of part in the community. And I love the lifelong learning.
Absolutely.
So in summary, again, I think we have a great clinic. We have, I guess, the doctors that are going to be combined together to have these ongoing care, and that's what the goal is. What, in closing, would you say is some of the reminders about why reach out to the Morrell Clinic and see if this is the right place? And what I was trying to remember to say, you're a healthcare home.
Yes.
And I like that. I don't like calling it a clinic. It's a healthcare home because this is a group that knows you.
Yeah.
So if you ever need, they know you had your appendix out 20 years ago. They know that you've had this condition, and it may not be why you're in the clinic yesterday, but a month from now, your healthcare home, the Morrell Clinic, is going to know you if you needed something or had a question.
Yeah, absolutely.
I think that's a great concept.
Yes. I mean, we are definitely a special practice. We're a little bit different from the traditional primary care home, with primary care centers, in the sense that we do have a team-based approach. And so you have your doctors, you have 2 doctors at every visit that that care about you, think about you. And then within our roof, we have a lot of additional services too.
And you can just reach out and you could almost walk in the same day or schedule the next day and get ongoing care. So I love that.
Yes.
Well, terrific. Well, we'll have the phone number for how to reach out to the Morrell Clinic. It's nice that it's centrally located. And I wish you the best. And thanks for what you and your team do.
Great. Well, thank you so much for having me here.
Hey, thank you. Take care.